Hello doctors, I hope you're all doing great. Welcome to Easy Medicine. This is the second part of the video on past papers of cardiovascular system. Please watch the first part of the video before starting this if you haven't already. You can find the link for the first part in description below. Let's begin. Please stop the video here, read the question and try to answer, then we'll discuss it together. Very good. So the diagnosis is mitral regurgitation, which has occurred due to rheumatic fever. And some points which can lead you to this diagnosis are fever and shortness of breath with joint pains and pansystolic murmur radiating towards axilla. In the first scenario, pulse is also irregularly irregular, and I have discussed it in previous part of this video that whenever you see irregularly irregular pulse in scenario, it means atrial fibrillation. And we also discussed in that video that one of the causes of atrial fibrillation is valvular heart disease. And we know that rheumatic heart disease affect mitral valve, which led to atrial fibrillation in this scenario. Let's see the answers now. Here you can see the answer is rheumatic fever leading to mitral regurgitation. The second scenario asks that what is the valvular lesion present in the patient, and that valvular lesion is mitral regurgitation. The next part of the question asked about investigations to diagnose this condition, and they include ECG, chest X-ray, echocardiography, Doppler, and cardiac catheterization. Remember that investigations to diagnose any valvular lesions are same as these we discussed for mitral regurgitation. The next part of the question asked about treatment, and treatment for mitral regurgitation includes medical therapy which involves diuretics, vasodilators, example ACE inhibitors. And if atrial fibrillation is present as it is seen in the first scenario, then digoxin and anticoagulation is also provided for treatment of atrial fibrillation, as we discussed it as a treatment of atrial fibrillation in first part of this video. And the second treatment option includes surgical treatment, and it involves mitral valve repair, which is preferred over mitral valve replacement. And here is the blue box with reference page numbers from Davidson so that you can check the answers yourself. Let's read the next question. Please stop the video here, read the question and try to answer, and then we'll discuss it together. Very good. So the diagnosis is acute rheumatic fever, and some important points to lead you to this diagnosis are history of sore throat followed by joint pains in a characteristic migratory sequence, and a macular rash with a clear center. It is called erythema marginatum, which we will discuss in a few minutes. There is also a soft mid-diastolic murmur at the apex or mitral area. Let's see the answers. See, the answer is acute rheumatic fever. The second part of the question asked about diagnostic criteria for acute rheumatic fever. This diagnostic criteria is called Jones criteria, and it involves presence of two or more major manifestations or one major and two or more minor manifestations along with evidence of preceding streptococcal infections. The major manifestations of this criteria are polyarthritis, carditis, subcutaneous nodules, erythema marginatum, which is characterized by a macular rash with a clear center, as we saw in this scenario, and Sydenham chorea. And minor manifestations of this criteria are fever, arthralgia, raised ESR or CRP, leukocytosis, and first degree AV block. And finally, evidence of preceding streptococcal infection is given by recent scarlet fever, raised streptolysin O titers, or positive throat cultures. And a mnemonic to remember major manifestations is given by Jones, and it stands for joints, carditis, subcutaneous nodules, erythema marginatum, and Sydenham chorea. The next part of the question asked about investigations, and investigations are done to fulfill the criteria. These investigations are CBC, ESR and CRP, throat swab cultures, anti-streptolysin O titers, and chest X-ray, ECG, echocardiography to check for carditis. Next is medical treatment. For acute attacks, benzyl penicillin single dose intramuscular is given along with bed rest and aspirin for arthritis. For secondary prevention, benzathine penicillin single dose intramuscular every month is given. The last part of the question asked about causes of diastolic murmur at the apex. These include mitral stenosis, atrial myxoma, Carey-Coombs murmur, and functional murmur due to volume overload, for example in mitral regurgitation or any other cause of volume overload. And here are the reference page numbers of Davidson from where these answers are taken. Let's read the next question. Please stop the video here, read this question and try to answer before we discuss it together. Good, since the question does not ask about diagnosis, so let's see the answers. First part of the question asked about causes of pansystolic murmur. These are mitral regurgitation, ventricular septal defects, and tricuspid regurgitation. The second part of the question asked about management of acute pulmonary edema, and we have discussed the management of pulmonary edema in first part of this video, where we discussed this management in context of heart failure. So the management is given by propping up the patient, giving oxygen by CPAP, administering nitrates until systolic blood pressure falls less than 110, administration of loop diuretics, and finally if all these measures fail, then using inotropic agents. And here are the reference page numbers from Davidson. Let's read the next question. Please stop the video here, read this question and try to answer, and then we'll discuss it together. Very good. So the diagnosis is acute pericarditis. And some points to diagnose this condition are chest pain which is worsened on deep breathing and improved on leaning forward. I have discussed it in previous part of this video as well, that chest pain of pericarditis is worsened on deep breathing and improved on leaning forward. And another very important point for this condition is scratchy sound on auscultation, which is also termed as frictional rub. This acute pericarditis is associated with pericardial effusion as well, which is indicated by a globular shadow of the heart on chest X-ray. Let's see the answer. So the answer is acute pericarditis with associated pericardial effusion. The next part of the question asked about investigations, and investigations for this condition are chest X-ray, ECG, and echocardiography. The last part of the question asks that what will be the treatment if the patient develops raised JVP, pulsus paradoxus, and hypotension. And presence of these three physical signs indicate that patient has developed cardiac tamponade. And treatment of this condition is pericardial aspiration with or without echocardiographic guidance. And here is the blue box for reference page numbers from Davidson. Let's read the next question. Please stop the video here, read the question and try to answer before we discuss it together. Very good. So the diagnosis is infective endocarditis. And some points to diagnose this condition are high-grade fever, macular reddish lesions on palms of the hands, splenomegaly, and presence of a murmur. Infective endocarditis usually develops in a patient who has damaged heart valves. And since patient of rheumatic heart disease has damaged heart valves, so they are at high risk of developing infective endocarditis. Let's see the answers now. Here you can see the answer is infective endocarditis. The second part of the question asked about investigation of choice. So remember, the investigation of choice for infective endocarditis is always blood culture. The last part of the question asked about management. And as every management, it will begin with history and physical examination followed by investigations. And investigations for infective endocarditis are complete blood count, ESR, echocardiography, ECG, and chest X-ray. The last part of the management is treatment, which involves administration of empiric antibiotics and cardiac surgery for debridement of any abscess or valve replacement. An important point to mention here is that the indications for cardiac surgery in a patient of infective endocarditis are heart failure, failure of antibiotic therapy, abscess formation or presence of large vegetations on left-sided heart valves conferring high risk of systemic embolism. And here are the reference page numbers from Davidson. Let's read the next question. Please stop the video here, read the question and try to answer, and then we'll answer it together. Excellent. So the diagnosis is hypertrophic cardiomyopathy. And some points to indicate you towards this diagnosis are a young patient with exertional chest pain and also presence of certain physical signs such as jerky pulse, double apical impulse, and presence of pansystolic murmur in third intercostal space and also presence of S4. Another very important point for this condition is that it runs in the family. So there is history of sudden cardiac death in family as seen in the scenario. Let's read the answers now. And as you can see, the diagnosis is hypertrophic cardiomyopathy. The second part of the question asked about investigations, and they include ECG, echocardiography, and genetic testing. And the investigation to diagnose this condition is echocardiography. The last part of the question asked about worst prognostic factors for this condition, and they include history of previous cardiac arrest or sustained ventricular tachycardia. And as we have just discussed, a family history of sudden death, exercise-induced hypotension, and recurrent syncope. And here are the reference page numbers for Davidson. And this finishes the second part of the video on past papers of cardiovascular system. Before ending this video, I'm sharing with you some bonus MCQs. These MCQs are made from important topics. You can solve these MCQs by stopping the video and writing your answers in comments below. You can solve these MCQs better if you watch both parts of the video. I'll share the answers to these MCQs in a comment below after a week from the day when this video goes live. If you have any query, feel free to ask in comments below. I'll be really happy to answer. If you like this video, give a thumbs up and share it with your friends so that they can benefit with these past papers as well. Please subscribe and hit the bell icon to get notified about upcoming past paper videos. Good luck.